machine learning algorithms, which are analytic techniques in the domain of artificial intelligence, outperform human physicians in distinguishing two clinically similar conditions using very simple and routinely available blood tests alone. Hello, everyone. My name is Joseph An, and I'm a third-year fellow in the Division of Gastroenterology and Hepatology at Mayo Clinic, Rochester. Today, I'm going to discuss our article, Machine Learning Techniques Differentiate Alcohol-Associated Hepatitis from Acute Cholangitis in Patients with Systemic Inflammation and Elevated Liver Enzymes, which was recently accepted for publication in Mayo Clinic Proceedings. To provide an overview, this study was motivated by my own clinical experience as a GI fellow in seeing the difficulty in distinguishing acute cholangitis and alcohol-associated hepatitis, which are two very different conditions that can present similarly. First of all, acute cholangitis is a very serious bacterial infection, which is usually caused by sudden obstruction of the bile duct, most commonly by a stone. Patients develop right upper quadrant abdominal pain, jaundice with abnormal liver tests and fever, and in severe cases can go into shock with low blood pressure and alter mental status. The treatment is performing a procedure called ERCP for urgent decompression of the biliary tree. However, there is another condition called alcohol-associated hepatitis, or AH, which happens in patients with chronic heavy drinking. Here, the liver gets very inflamed as a result of long-term drinking, and patients also present rather acutely with right upper quadrant pain and jaundice, and oftentimes have systemic inflammation. In cases of severe AH, patients can also become hemodynamically unstable and be altered as a result of hepatic encephalopathy. Therefore, we decided to train several machine learning algorithms that can distinguish the two conditions using some of the very simple and routinely available lab values that all of these patients should have. We identified a cohort of 459 patients who were admitted to Mayo Clinic with acute cholangitis and alcohol-associated hepatitis, and collected information on their initial lab values from the complete blood count and liver biochemistry at the time of admission. We trained 8 supervised machine learning algorithms, including decision tree, Bayesian algorithms, logistic regression, k-nearest neighbor, support vector machines, artificial neural networks, random forests, and gradient boosting for classifying the two conditions. Overall, the machine learning algorithms demonstrated excellent performances for discriminating the two conditions with over 93% accuracy. We also performed an external validation using a cohort of ICU patients from the Beth Israel Deaconess Medical Center in Boston, and our machine learning algorithms again showed excellent performances here as well. Finally, we compared the performance of the machine learning algorithms in their ability to distinguish the two conditions against over 100 physicians, and found that machine learning algorithms greatly outperform the human physicians. This study highlights the potential for machine learning algorithms to serve as useful tools in clinical decision-making in cases of diagnostic uncertainty. There are many instances of gastroenterologists receiving consults for urgent ERCP in patients with abnormal liver tests and systemic inflammation who initially deny a history of alcohol use but later turn out to have AH. In some situations, inability to obtain a reliable history from patients with altered mental status or a lack of access to imaging modalities in underserved areas may force providers to make the determination based on a limited amount of objective data. If made easily accessible in the form of an online calculator or a smartphone application, our machine learning algorithms might also be helpful to mid-level providers or subspecialists who may not be too familiar with how to approach an acutely ill patient with abnormal liver enzymes. For patients, this will lead to improved diagnostic accuracy and reduce the number of additional tests or inappropriate ordering of invasive procedures, which may delay the correct diagnosis or subject patients to risk of unnecessary complications. For the next steps along this line of research, this study is a proof of concept demonstrating how Machine learning algorithms utilizing just a few simple and routinely available structured clinical information may serve as highly potent clinical prediction tools. There are numerous different clinical conditions that are quite different, but can be hard to differentiate with similar symptoms and laboratory profiles. Using a similar approach to our prediction model, it might be feasible to develop a comprehensive machine learning-based software that can guide medical providers treating patients with abnormal liver tests that can aid in a more accurate decision-making. Thank you for tuning into this video interview.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.